Dr. Johnny Marshall is Director of Policy at the NHS Confederation, represents more than 500 NHS organisations. Is it achievable, or are we being hoodwinked, like Sarah said?
Well, I think there's a real tough challenge in ensuring that we can address some of the problems that David Cameron addressed or highlighted, that people are coming into hospital at weekends, and that unfortunately is not resulting in them having such a good outlook. So I think it is possible for us to change the way we deliver services. It won't be more of the same. It will have to look different, and make sure we're joining up services in the community and in primary care alongside with hospital services, so people get the care where they need in the right place.
So is it achievable then?
Well, I think it is achievable. There are examples in the country where people are coming up with different ways of delivering care that, for example, connecting residents in care homes and the staff that look after them to nurses working in hospitals that can then give them advice and ensuring that they're getting 24/7 care. It's just in a different way from how it's been delivered before. And that's resulting in less people going to hospital, spending shorter periods of time in hospital. And it's that sort of change in the service that's going to enable us to deliver that sort of level of care.
Yeah, but we can't have a full 7-day service without more GPs for a start coming into the mix, and that's not going to happen. That step change isn't going to be achieved in this or the next Parliament. You know, from a standing start, we'd need at least sort of 10 years to get a properly qualified GP.
Well, you're right, and it takes a long time to train GPs, and perhaps we do need some more GPs. But actually, it's looking at the workforce in general, not just looking at GPs, not just looking at doctors, but how nurses can play a different role, how other people that work in the community, pharmacists, even social workers, they have social and people that deliver care have an important role to play. I guess that the thing is, it's not about providing the current level of care in exactly the same way 24/7. It is coming up with new ways of doing this, and people providing support in a different way to people that will enable us to do this.
Okay, I take your point. You can organise it better, but a number of people, nurses for example, you're going to need more nurses working weekends who aren't doing so at the moment. Now, the Royal College of Nursing is already warning of potential strike action, and they won't be the only ones, I'm sure, if you're asking people to work 7 days instead of 5.
No, you're absolutely right in that we need to have the right workforce to deliver the right level of care to individual people. All too often, the services aren't based on individuals' needs. So someone who's living in the community, who becomes unwell, perhaps a frail older person, who could benefit from the medical treatment being at home, if only there was more support around them to keep them at home, those sort of people end up in hospital, and they put a burden on the nurses that are working, hard-pressed nurses working in that sort of hospital setting. So it's really important that we look at the workforce across all of the service, not just focusing on hospitals, so we can get care to people earlier in the place where they need it. Adrian, that's going to be the thing that makes a difference, and that's what we at the NHS need to be working with the public at a local level to understand how that changes the services they receive locally.
But, you've got a very positive can-do attitude, and I'm sure the Prime Minister would commend you for that. But I just wondered what you say to Sarah, who's the clinical manager from the NHS, who has said, I promise you, it cannot be done on the funding I have. We're absolutely down to the bare bone as it is.
Well, I think funding is a really important issue. We've already said and supported the plan from NHS England that there should be at least £8 billion of additional funding going into the NHS. And the important thing for people like Sarah to be able to plan the services is knowing when that money is going to be coming. And I think, although it's good to hear David Cameron affirm the sense of £8 billion coming into the NHS, what we now need is the detail so that people like Sarah can get on and plan services accordingly. We also need to be aware that there's a £4 billion hole in social care services. And if we don't have a plan that addresses that, then what we'll find again is the people that should be looked after in the community with social care support will end up in Sarah's hospital having to be looked after inappropriately. So we've got to get that right to help people like Sarah too.
Okay, Dr. Johnny Marshall of the NHS Confederation.